I should make it clear that I'm standing in this afternoon for Paul Devlin. Paul has got some quite serious domestic issues that he's got to sort out, and that all happened at short notice. So he asked me yesterday if I would if I'd fill in for him. So that's the reason that we're doing it in this manner. Welcome everyone, and thanks for being here in such numbers. It's great to see you all, and although I suppose it's a little late, I do wish you all a happy new year, and let's hope it's a successful one and better in very many ways than last year. A few things to talk about at the beginning. It's today we've got a number of governors who are attending their last meeting as their period of tenure has run out, and so that's Anita Assel, Derek Brown, Helen Caldwell, and Paul Longhorn. Thank you.
Yeah, you can walk. You are not seeing.
So thank you all for everything that you've done, and I pass on Paul's best wishes for everything that you've done. It's also Jean René's last meeting, but he has been nominated for re-election, so this may or may not be the last meeting. So Jean René, thank you for everything you've done, and we will be welcoming you back or not, depending on the election. We're also saying goodbye to two other stalwarts of this committee over a long period, and the first one is to Becky Cassidy, who has supported this group throughout, certainly the time that I've been at the Trust. And she's leaving us for a very significant promotion with University Hospitals of Leicester. So, congratulations to you, Becky, and you'll be sadly missed. And I think we do need to put on record the very significant contribution that you've made to the Trust, but in particular this committee over a long period. And as we were bantering earlier on, this will also, I think, be Steve Banks's last meeting, and you've attended this meeting in several forms over time, Steve. But again, although you're leaving us because you've come to the end of your allowed tenure at Notts Healthcare, you will be staying close by. So do you want to tell people what you were doing, Steve?
Yes, thank you, Stephen. Yeah, I'm delighted that I'll be carrying on as a non-exec in the NHS, and I've joined Sherwood NHS Trust. So looking forward to that. But as I was saying before we started, we're all one happy system. We're on that way, and there'll be, I hope, lots of opportunity to work together and make things better. So I'll look forward to continuing with you.
Yes, and Becky, I see you put your hand up.
Thank you. Yeah, I just wanted to jump onto this cog because it will be my last one, which feels really strange. And but there are quite a lot of governors that are on today that I've had the pleasure of working with over the last probably 6+ years. And it's so nice to see some of the faces come back. Steve Howe, obviously you've joined us again recently, and just I suppose I just wanted to say thank you, and thank you for all your support and kindness over those years. So thanks very much.
Best wishes.
Okay, well, best wishes to all, and heartfelt thanks for the massive contributions that all of the individuals that we just mentioned have made to this committee and to the Trust more broadly. So can I turn to you now, Lucy? We've got some apologies for today's meeting.
Yes. The apologies I'd received, I'll just wait for my cursor. Paul Devlin, obviously, Paul Longhorn, Anita Astle, Julie Walton, Helen Caldwell, Rob Gardner, John Doddy, Roshan Dasnair, Julie Atfield, Sue Alcock, Becky Sutton, Claire Teeney and Sarah Furley.
Thanks, Lucy. So we can record those. Can we now turn to the minutes of the previous meeting? And first of all, can I just ask if there are any issues on accuracy, any comments or edits?
No, it's fine, thanks.
Thank you. So I think we can move on. So then, turning to matters arising from those minutes, are there any matters arising which are either not covered on today's agenda or in the action points? So anything? I didn't pick up anything in my reading, but no, I'm getting nothing there. So I think we can accept them as a true record and move on. Can we then look at the action points, please? And so there's action 045. I think that has been completed. Lucy, there was also action 046. Is there anything to update on 046, Lucy?
No, we're just waiting for a date in the diary for that one. So I will update and send the invitation round as soon as I can.
Okay, thank you. So we'll carry that one forward if we can. And then 047, the well-led report, that action has been completed. Good. Yeah. Good. So now we turn to the lead governor report. So Jim, over to you for an update.
Yes, thank you, Stephen, and Happy New Year, everyone. Let's hope 2022 gives us more in-person meetings than we've had for a couple of years with just the one in October. I'll take the report as read, Stephen. When I was compiling it, I was thinking, well, there hasn't really been the opportunity to do very much. Obviously, the non-exec director recruitment stood out, but then when putting it together, more has happened in the last 3 months than I had initially thought. And the non-executive director recruitment is a later item on the agenda, as indeed is the appraisal. The chair's appraisal that I've mentioned in my report. But I would like to say that the visit to Rampton, which was arranged for us by Graham Woodward, and thank you, Graham, you're at the meeting today. Several of us were able to attend as named in the report, and that gave us a great insight into the issues and opportunities at Rampton, and reinforced the view that as soon as we can get back to in-person visits, the better. I'd also like to pick out the opportunity that the calendar allowed for me to attend an in-person meeting with Healthwatch, who are a key stakeholder. They had their AGM in December. They took the opportunity to showcase their work. And one thing that stood out from that, which is a hot topic for the Trust, is health inequalities in Nottingham and Nottinghamshire. It will be very good to maintain this. I'm making this comment now for the council as a whole. Very good to maintain our links with Healthwatch in the year ahead. I also refer in my report, in the context of the system development and recognising Steve Banks's role, that the links with Sherwood Forest Trust continue. And last week I was able to join their membership and engagement meeting, a virtual meeting, which enabled me to do a couple of things really, one of which was to reinforce the idea that in the course of the year ahead, we will look at joint projects between the two councils of governors. Incidentally, they also have quite a substantial number of vacancies that are being elected to at their council of governors this spring. Once those elections are over for both of us, we can be thinking from April onwards of ways in which we can serve our communities through perhaps some joint project work. And finally, to pick out from my report, the hardest task of all that Helen Caldwell and I were involved in, which was the final list for the Oscars, 480 nominations, remarkable range, a thankless task. Stephen, it's the most thankless task I had since my days in Mansfield, when the local paper asked me to judge a baby contest. You know, imagine selecting the most beautiful baby and having 6 irate parents criticising you for not choosing theirs. But that was a terrific morning of going through all the tremendous work that goes on in the trust, and I very much look forward to the final in March. So that's my quick overview of the report, and I welcome any comments or questions.
So do we have any questions for Jim on his report? It's not looking like it, Jim. I think it was a very clear report, and certainly the number of Oscar nominations has been, you know, literally overwhelming, and you know, it's a huge read, but an inspiring one, and
yes,
a good task to do. I think it has to be said. So I think I'm not seeing any questions there. I think I can see most of the screen, but if I miss anyone, please shout out. So then we can move on to Paul's report. Now, again, I think we've got quite a few people in the room, so if you ask any questions about Paul's report, we'll try and field it as best we can. The report was written by Paul himself. He's given us an update on his activities, very similar to the similar sort of report that we receive at board, but it does show the range of activities that he's been involved in, particularly in the pre-Christmas period, and taking a very active part, obviously within the trust, but also at a system level, and waving the flag for us at a national level, which I think is really good to see. Happy to I say to try and take some questions if anyone's got anything they'd like to ask. No, well, I'm not picking anything up, so I think it's a good update to get. Can I now turn to John Bruin, Chief Executive, to give his update, please?
Yeah, thanks, Stephen. Afternoon, everybody. Belated Happy New Year. I take the report as read, although there's a comment in it that much of what was written is has become very quickly out of date given the times that we've been living in over the last 4 or 5 weeks. I'm going to focus on the bullet points in the executive summary just to bring governors up to date, and then obviously happy to take any questions on any of it. But you'll all be aware of the challenges that we've been working in, not only in the trust, but in the wider Nottingham system, but also nationally from a health and social care perspective. We've really been under the cosh, and working on what's called National Incident Level 4 since mid-December, which is essentially a command and control environment where instruction comes out from NHS England Central Command, and we're told to make it happen. That we don't get things for discussion or observations. So that coincided with the Omicron wave, which you'll be aware was responsible for so very many numbers of cases, and that's had a massive impact, particularly on our staffing levels right across the organisation in all of the 3 clinical divisions and in the corporate divisions too. It's been variable, but we've had absence rates of approaching 20%, 20% in some teams, which you can imagine really impinges on or challenges the team's ability to keep business as usual going. So that's been a combination of people who have tested positive for COVID, people who are isolating to abide by the rules, but also more recently, non-COVID sickness has also increased, as it often does in January, and we're not unusual or an outlier in any of that respect. So maintaining safe staffing, for example, across our 70 wards in the organisation has been a real challenge, and many staff have really stepped up to the plate and shown tremendous levels of resilience and professionalism to keep the show on the road. But just to give you an example of some of the things we've had to be considering, we have a sort of a priority list of things that are either slowed or stopped. We've tried to maintain all services, but we've been having conversations, for example, of for non-urgent assessments, there may be additional delays, and you see that in the news, don't you, of elective waiting lists going up and up. But we maintain vigilance for all people that have been referred to make sure that they've got access in if the situation deteriorates. We were having conversations just after Christmas into the early New Year, for example, of having to share the only professionally qualified nurse across more than one ward to cover a shift, which is unprecedented. We didn't actually get to that, and we were able to recruit through agency to prevent that happening. We were having to focus in the community services division onto the urgent and emergency care pathway to help the flow out of the acute hospitals. So that meant that some of the generic community work again was slowed. And that sort of gives you a flavour of some of the challenges we've had to have. So my first pause is to say a huge thank you to all staff across the organisation for what has been tremendous response to a really difficult time. I'll pause there because I see Graham's got his hand up. Graham.
Hi, yes, John. Just in relation to several things. I had a 76% staff deficit over the Christmas and New Year period, and personally on several occasions, as the only qualified, oversaw two wards. So that information is not quite correct.
Yeah, thank you, Graham. I mean, it just emphasises, the huge challenges that we've had to face, and I know that in the forensic division, both at Rampton and in the medium secure units, especially, it's been really, really difficult. So to continue, the other challenge has been managing the high number of outbreaks, which are the positive cases either in staff or patients in teams and on wards. And the note there that says we're 40 plus at the minute, as of yesterday, we were 50 plus. And we are identified. Sorry, my screen keeps wanting to shut down. We are identified by NHS England as an outlier for having such a high number of outbreaks, but we are also by far the largest mental health learning disability provider in the region. We have such a diverse range of services, and for example at Rampton, where there are over 20 wards and a large number of teams, everybody has to go through the same entrance door essentially to get in. So there are some mitigations for that number, and pleasingly the rate of increase of outbreaks has plateaued, and we are expecting them to fall sharply, as many other graphs are turning the corner over the last week or so. We spent a lot of time supporting the system. There's a huge national emphasis on the ability of the larger hospitals to maintain being able to admit patients to their wards, to empty emergency departments, and to maintain services for urgent elective care. So, for example, cancer treatments. I mean, of course, if the hospital beds are not available because they're full of COVID people, then really important emergency operations have to get cancelled. So again, we've been working really strongly with Becky Sutton and her team, supporting the system to ensure that adequate flow is maintained. There are a number of pages of what are called derogations from usual practice. So just to give you an example, we may not expect appraisals to be done on time, or certain elements of training may be deferred. Observations may not be recorded exactly in the timely way that what business as usual would expect. There's lots of detail, and just to give you some assurance around that, that is all logged, recorded, reviewed by the executive team, and also goes to board. So there's a proper audit trail to make sure that we've got the right amount of scrutiny around those, and that they only occur for the minimum amount of time required. Just to say a little bit about vaccinations, hot topic. I'm sure you'll be familiar with the story. In terms of the vaccination program of people that live in the county, we remain playing strongly into that. We're also making sure that all our inpatients have easy access to their vaccination and booster requirements. The most challenging issue, as I'm sure you'll be familiar with, is the legislation being passed for mandatory vaccinations to be required for all patient-facing staff that are providing what are described as CQC registered activities, which is essentially the services that we provide, and that comes in that's requirements on the 1st of April, which means that from the last date to get your first jab is the 3rd of February. We're currently doing some data cleansing to accurately ascertain which staff have been vaccinated and which haven't, and then we're identifying those and having one-to-one conversations to enable them to make a decision about receiving the vaccine. We've got a variety of media available to help people feel fully informed, and we head over the next few weeks to, I think, what's going to be a difficult time for most of the NHS, because there are, significant numbers of people for a variety of reasons who do not want to take the vaccine, but to emphasise it does become law from the 1st of April. I can see another hand there. Helen.
Yeah, in today's times, John, they refer to a care home nurse in Sheffield who's been sacked over the jab refusal, and she's lost her tribunal case.
Sorry, Helen, I didn't catch the end of that.
There's a nurse, a care home nurse in Sheffield, it's recorded in the Times today, who has refused the jab, and she's lost her tribunal case. So they're pushing hard on that.
They are. They're pushing very hard on it, and this legislation came in earlier for social care, almost perhaps as a sort of test as to of the water. We are obviously looking to do everything we can possibly to avoid anybody losing their job. So there are people who can be medically exempt. There are some flexibilities around the definition of patient-facing roles, and there are some opportunities to put in some temporary measures around people's job plans. There is also, you may have picked up, some potential for the decision to be delayed, and there is also some mounting narrative that when the legislation was passed, this was based on data from the Delta variant, and now we are all awash with Omicron, where the data is very different, both in terms of the severity of illness that people have, and also the efficacy of the vaccines. And so whilst we continue to do the work to prepare for the 1st of April, we are keeping a watching brief on the sort of signals that are coming out from the centre on it. But at the minute, I think they remain very steadfast that April the 1st will be a cut-off. We're working with, we're keeping in touch with all our peer trusts to see how they're working through, but also closely with the regional team to try and mitigate the potential impact. And that, I mean, there are some, again, you'll see it in the media, there are some professional groups and some trusts that have very significant numbers of staff who are refusing, and there just doesn't seem to be any sense or any reason why such large numbers of staff would lose their job in April. There's a big London trust where 40 out of 44 midwives are saying they don't want the vaccine. And the babies are going to still come. But we do appreciate that this is a very sensitive area and controversial, and there are lots of fairly hard-won opinions about civil liberties versus protecting patients under our care. So it's a tricky one to navigate, and we're working hard with a lot of people to make sure that we can get the best result for it. I don't know, again, Stephen, whether to pause there, whether there are other questions, particularly around the vaccine, because I know it is a tricky issue.
Yes. So are there any other questions for John around COVID, vaccinations, those sorts of issues? Julie?
Yeah, I just wondered, I know you're looking at data, but, what levels of risk are there? What, number-wise, if the cut-off date for the first vaccination is the 3rd of Feb, we're almost on it. So what, do we know what kind of scale of risk it is within our trust?
Yeah, hi, Julie. Do you mean in terms of numbers of people that are not vaccinated? Yeah. So without getting bogged down in too much detail, one of the challenges that all trusts have is we have a sort of central database of people's vaccination status, which is produced nationally for us, but we know it's inaccurate because particularly for us, because we have a lot of staff that don't necessarily work or live in Nottinghamshire because of the services that we provide, and people can have received vaccines from all sorts of different outlets, as it were, from community pharmacies, GPs, mass vaccination centres, hospitals. So They may, and there's also an inaccuracy around if there's a wrong number on a postcode or the name is slightly misspelt, they can automatically appear to be not vaccinated. So the first part of the checking the data is for us to be contacting all those that our records say no, they haven't had one, which was just over 1,000 at the beginning of January, to check with them whether that our record is accurate and for them to provide evidence that they've had a vaccine. So that's been that, and we're still in the process of that. And we think we're going to get down to about 500 people who won't have had a vaccine.
Okay, so the worst case scenario would be 1,000, losing 1,000 staff.
No, the worst case is 500.
Okay.
And
John, are we aware of any, you just gave the example of the midwives, where a high percentage don't want the vaccine, so that's a real hotspot. Are there any areas of risk, pockets of risk that you're aware of within the trust?
No, we haven't quite got down to that level yet, Julie. I mean, I must emphasise that our vaccination rates as an organisation have been impressively high. From I think it's something like 96 and a bit % of people have had their first vaccine. The slightly lower numbers for the second and booster vaccine, but the staff have been tremendous in availing themselves of the vaccination. So I'm still optimistic that we can get to a really good place, because for all sorts of reasons, we don't want to be asking staff to leave, because we wouldn't want that to happen anyway, but also because of the huge challenge we have around staffing anyway, irrespective of anything to do with the pandemic.
Thank
you. Thanks, John. Any other questions for John on COVID or vaccinations? Jim.
Yeah, thank you. Actually, it's not on COVID or vaccination, so I'm happy to hold to see if anyone wants to come back in on that.
Yeah, because I think John wants to continue on other issues, Jim. So we'll come back to that momentarily.
Yeah, fine.
So I can't see anything else on COVID or vaccinations, John. So if you would want to continue with your report.
Yes, thanks, Stephen. Not very much more to say, really. The report is as it stands. As ever with the CQC, we continue our engagement conversations with them. They've largely stepped down most of their visits and inspections, again across the country, are only going into organisations where they've got very significant concerns about risk. We continue our work around quality improvement, and as this wave relents, we'll start to step that up again. But we are still overdue a comprehensive inspection. To note, the only other thing to note about the CQC, we had what's called the National Oversight Group, which is the national heavyweights who oversee all the performance in the 3 high secure hospitals, and this was following a visit of the NOG to Rampton before Christmas, who were able to be hugely impressed by the work in the hospital, and it was raised at NOG, which the CQC sit on, saying that asking to make sure that the CQC were cognizant of the fact that their last published report is old, and that NOG felt that many of the services that are currently in operation at Rampton are not accurately rated, in that we still have inadequate ratings for safe and well led. So it's pleasing to find that NOG is batting for us, as it were, and at some point, I don't know when, they will be back, and we're optimistic that we can improve some of the scores. Just very briefly, the rest of the report really shows that what I've said around some of the divisional headlines, the pressures that staff have been working on. And there's a detailed piece on communications from Yolanda's team on some of the activities the trust's been engaged with, and also some of the nominations and winners of various prestigious awards of late. And then to finish, I just would like to echo my thanks to both Steve Banks as a really valued member of the NED team and the board. His help, support and commentary as I found invaluable over the 3 and a bit years I've been here, and also to Becky Cassidy for her hard work, support and professionalism in the same timescale, and to wish them both well in their future ventures. Thank you.
Thank you, John. I'm sure it's appreciated by both of them. So I've got Jim first and then Graham. So Jim.
Yes, John, I just wanted to say thanks for a very comprehensive report, first of all, and the detail was very illuminating. And although you passed over it near the end, the number of nominations for external awards is really important, I think, for governors to note. And I wanted you to sort of hear that it's impressive. And at a time of particular strain and stress on the trust, we ought to, I think, appreciate the extra mile that people are going to. You touched on CQC, John, but in your report you also mentioned a couple of focused visits. I think Cam's got a mention, and there was the joint visit regarding special educational needs and disability. I wondered if there are any updates on these quality visits that we had recently.
Yeah, thanks, Jim. Yeah, just to say a little bit more about the nominations and awards for staff and teams. I mean, I think it's a really important part of how a trust operates to recognise the work that people do, and I've increasingly felt that this trust has perhaps hid its light under a bushel a bit and not celebrated some of the fantastic work that goes on, and we're starting to show now that it is on a par with some of the best practice nationally, with some individuals and teams winning national awards, and it's something that we'll continue to emphasise and to encourage. Yeah, I haven't got to hand the detail of the CQC and Ofsted report, so I can make sure that I can get a summary piece to the council. Just a little bit more detail. That they were both important in their own right. That the children and young people one was important because it was a system review of children and young people work, so it wasn't at an organisational level. So it included all organisations that are involved in commissioning and providing young people's care. The overall flavour of it was a very positive commentary. They don't have a rating as ordinarily, but they can make recommendations. But we've got from just before Christmas a pack of summary points that I'm very happy to share, and ditto with the Ofsted one with the educational needs review too. I can
thank you. That would be helpful. Yes.
Get some detail.
Thanks, Jim. Could I go to Graham now?
Thank you. Yeah, John, it's just in relation to the bonus payments that were brought in by the trust for certain areas. It's made quite a few staff rather disgruntled. Certainly my fellow staff at Rampton, who were not part of it, I may understand reasons why that was, but also a lot of people who work in areas such as I do, like Rampton, who do our 150 hours for the trust and then work on local services bank, who were then told that they wouldn't receive that despite sort of doing their 150 hours a month and then doing 40, 50, 60 hours to support other areas when you know yourself over Christmas and New Year staffing was at an all-time low, and they feel a little bit let down, to be fair.
Yeah, thanks, Graham. So the decision around additional incentive payments for staffing is informed by the operational divisional exec directors, and it's particularly focused on areas that are especially difficult to staff and staff safely, and we have to make a decision on you know, relatively fixed budgets where and identify priority areas, and we do appreciate that we're not able to please everybody all the time, but it's a tough call. So thank you for your comment. We do always try and respond to feedback and finesse our approach.
Thanks, John. Malcolm, I saw that your hand flickered on and then it's flickered off again. Do you have a question?
Yes, thank you. Well, just reading that report, I was just looking at the Allied Health Professionals Workforce Strategy Project, and I was just curious what take-up's been like for the face-to-face and MS Teams listening events. Have many staff gone for that?
I'm sorry, Malcolm, I've got no idea on that that level of detail on that question. I can't help you.
Okay.
Okay, thank you. I've got another hand raised, but I can't identify. Oh yes, there we are. Palab, have you got a question for John?
Yes, Stephen. Thank you. Thanks, John, for very comprehensive and succinct report. I was thinking about the self-isolation and rules that we get updated on. It's like ever-changing guidelines coming from the center, and it's complicated to keep on top of it. I mean, as I remember in the beginning, I think sort of our organization took a more conservative and a safe approach to keep patients and staff safe in terms of self-isolation. I mean, from staff's perspective, obviously anecdotal and from my sort of pocket of practice, we see that sort of quite often this the way the self-isolation sort of being practiced at the moment, it almost sounds like the lateral flow equivalent of the pandemic that we had earlier last year. And I know that sort of the government is sort of dropping the duration and being a bit more bold and brave about sort of the self-isolation rules. I mean, and I myself experienced and included in that of being eager to actually get back to work and sort of contribute, and feeling for the staff being stretched on the ground, but not being able to, feeling like your hands are tied because of the restrictions and the rules. So I was just wondering whether sort of like what's the sort of the direction in that area with regards to sort of where the organization sits. I mean, I know that the government's probably going to relax rules a bit more towards the end of this month, and sort of what are our plans, because that might help in terms of sort of releasing the existing workforce pressure at the moment.
Yeah, thanks, Palab. The numbers on staff absences are improving day on day. That we're not quite back to sort of business as usual, but they're all moving in the right direction, which is really pleasing. We just had the announcement yesterday, sort of for everybody, and what usually happens is that we get a bit more detailed. So what does this mean for the NHS? That will come down the line probably today or tomorrow. I note in the corner bottom of my screen, I've got the Queen of the Infection Prevention Control Regulations, who, if I get anything wrong, will correct me. So I'll hand over to Anne-Maria in a second. I think you probably summed it up pretty well, Palab, and we're expecting that the rules on self-isolation are going to reduce and then finish within a pretty short period. There may be some specifics where the NHS is different, whether it's in closed high risk clinical areas. There may be some rules, for example, that change whether it's on an ITU ward or on a locked forensic ward. It's difficult to predict, but I think that it's generally good news that I think there'll be an increasing ability to get out and about. We're just starting to work up some high level messaging for staff. We're going to need a bit of time to think about exactly what the future entails in terms of working from home and that work-life balance. The benefits of things like Teams are obvious, and that's going to take a bit of time to make sure that we don't have people that end up being isolated on their own at home with no contact with the trust or their peers or their team. So that will take a bit of time, but sorry, it's a bit vague really. We're right at a pivot point, I think, on some quite significant changes to the rules. I don't know, Anne-Maria, whether there's anything more you wanted to say on that.
No, I think you have covered it. I think my difficulty is, and I'll share this with you, in kind of like bearing my soul, is that a lot of trusts probably will be able to reduce, but we are sitting on 55 outbreaks. So because I'm sitting on 55 outbreaks, I cannot be seen to be saying, oh yeah, everybody back, take your masks off, take your visors off. I just cannot do that in the position that we're currently sitting in. But I have really, really high hopes in the next 7 days we're going to be able to close a lot of those outbreaks, because most of them occurred over Christmas and New Year due to different behaviours and whatever else was going on. So I think in the next 7 days we'll start to see a reduction, and then we will be able to apply the new guidance that comes out for healthcare. And John's absolutely right. What happens is he makes a big announcement, it goes to the public, they'll go, oh, this is what we're doing. And then about 3 or 4 days later, we then get it for healthcare. We have to interpret it, because often it's quite complicated, and then we make sense of it and make sure that it goes out on a good communication to say it's really, really clear. With regards to masks, I cannot see us reducing masks for quite some considerable time, even though they're coming down from the public perspective. But I think for us in healthcare, that will stay for some considerable time. But hopefully some of the other things, returning to offices. Actually, really interestingly, I've just come off the incident control team meeting. One of the big things that is we may have caused ourselves a little bit of a problem, because we've said for people to work from home. We've reduced all of the cleaning in the non-clinical areas. So the execs all have to take home the bins and do their own sort of looking after their own offices and everything, which is absolutely fine, and it's the correct thing to do. But of course, we haven't necessarily got the infrastructure now, because we stopped it all in order for it to be concentrated in the rightfully in the clinical areas that needed the deep cleans after all the outbreaks that we've had. So we're in a bit of a chicken and egg situation. We want to get people back, but we've actually made sure it's all in the right places where it should be. So we've got a bit of work to do. It's going to take us a couple of weeks, and then we'll get there. That was a yes and a no, wasn't it? Sorry, Dr. Broom.
Good. Shirley,
thank you. Thanks. I think you know, John's report was very comprehensive, and I think, you know, it was sent out prior to the meeting. We've had a lot of detailed questions, and it would have been useful to use the issues log, because then we would have been able to provide the detail if you're aware of the questions before the meeting. We've got now a couple of things that we need to respond to. So you've got a fantastic process here of the issues log that I've never seen before. And I think if we could have used that before the meeting, we could have provided more detail in the meeting if we know where the questions are. I appreciate you've got questions once you've heard the verbal feedback, but I think if we could, you know, utilise that issues log more, it would make it for a richer conversation in the meeting. It's just a suggestion.
Okay. Thank you, Shirley. That's a good intervention. I was going to make a similar comment myself. So, Palab, have you got another question, or is that a legacy hand?
Yeah, it's not a legacy hand for a change. So another question about the vaccine. I mean, I don't know whether sort of John would have that level of details, but I was just thinking about sort of the approach to address vaccine hesitancy and the activities that are going on around in the organization, like a general view. I remember sort of being involved in some of those campaigns using the BME network platform earlier last year. So I was thinking, because the deadline is looming, so are we taking more of a targeted one-on-one approach, or are we still doing some kind of using certain platforms and sort of like workshop general sort of approaches to change people's minds still? Or is it too late for that?
Yeah. So yeah, good question. Thanks, Palab. So both really. We're doing we are doing one-to-one, but we're also providing a series of workshops, webinar type things for both for all staff. And there's a targeted one for BME staff, which have got a high percentage of people who are hesitant. So it's a sort of mixed model. So watch out for that, because we'll be making sure that people are aware that that they're around over the next couple of weeks. Thanks.
Thank you.
Thank you, John. Anne-Marie, do you want to come back in again?
Yeah, it was just, I've got an answer for, now was it James who asked the question about AHP's workforce strategy project? Was it James? No? Who was it? Somebody asked the question. Oh, Malcolm, I've got an answer for you. The sessions have been well attended and engaged, everybody engaged in the conversations. We've put in 2 part-time leads working with the AHPs and workforce colleagues. The themes that have resonated so far are a lack of opportunity, they want to stay, they want opportunities to advance in clinical leadership, and there's a disparity in banding between the directorates, and some professions, to be fair. But I hope that answers your query.
Yeah, it does. Yeah, that's great. Yeah,
no problem. I'm here for the instant response.
Yeah, you come out the corner now. Yeah. Thank you,
Anne-Marie. You've extended your remit to being also the queen of the instant response.
Yes, that's it.
Just on similar subjects to what Shirley was talking about, Lucy, there are a couple of points, particularly from Rhiannon and Jim, that have appeared in the chat, which potentially I think we can pick up answers to in due course. So if you can make sure you capture those, and that we can provide responses in due course.
Yeah, got those. Thanks.
Good, thank you. Well, thank you, John and Anne-Marie for your time and those really good reports. I think as a Council of Governors and certainly speaking on behalf of the non-executive directors, we just want to acknowledge what a fantastic job the executive team and their teams cascading through the whole organisation, the entire workforce, are doing in unbelievable circumstances, in circumstances that we could never have previously imagined, and yet somehow we're managing to keep coping, and it's it's a brilliant effort, and I think that we as a Council of Governors and certainly as a group of NEDs that we want to support you in every way we can in continuing to do things in the way that you are. So thank you.
Thank you. Thank you.
So if I could now move on, and I think we go now to Jim and the Council of Governors issues log.
Yes, thank you, and thanks to Shirley for giving me an intro to it, Shirley. Since we actually did promote the use of the issues log at the last Council of Governors meeting, and since then we've had about half a dozen issues raised, which is probably about what you'd expect in normal times. Several of the governors who raised issues are here today, but we can see from the issues log that there has been at least an initial response to all those issues that have been raised. It's working as a tool again now. It went through a bit of a lull, I think, last summer, and it's an effective means in my view, and I think several governors are making use of it. It's an effective means of keeping in touch on issues that arise between meetings. So it speaks for itself, Chair, and over to the Council for any comments.
Yes, so any comments or questions for Jim? Sue, I noticed you've got your hand raised.
Yeah, I don't know if it's, excuse me, Sue Nixon, Non-Exec Director. I don't know if it's helpful, Jim, if I could just add to a couple of points on some of the queries that were raised with me, just to give the most up-to-date position. Because we had a people, culture, equalities and inclusion meeting today, so there was a further opportunity to clarify things. The two bits that I'm talking about is the point that's on the bottom of page 28, where I think Malcolm asked for assurance about consistency of approach to support staff governors from across the divisions to feel supported and so on. I've had a couple of discussions with Claire on this, and as you may well be aware, staff governors are giving up some of their time and supporting the trust, but also taking time out to try and undertake some of their governor duties. And this question clearly suggests there may well be some inconsistency. Now, as I've said, I did speak to Claire on 2 occasions, and she said that obviously in the letter that goes out to staff, staff governors are encouraged to take whatever reasonable time is required to be able to do their duties, and in the first instance to speak with line managers. But Claire has always said to me that actually if staff don't feel either they're getting access to be able to talk to their managers or sufficient time to be able to do their duties, her letter always says, please come back to me, Claire, and she will try and help or support. She said and reaffirmed again today, nobody has come back to her at all. So I'm just wondering whether, is part of this question an issue much more about not having enough time to do some of the duties, or is it more about too many other things are conspiring, or people want a different type of support or a different training? I didn't know whether anything had come out from Malcolm's reflections on this, because again, as I say, Claire has said nobody has come to her at all. So the assurance bit is obviously open to interpretation, maybe, in terms of what a line manager might give as this is the amount of time that we think is reasonable. And I thoroughly accept that most people are very sensible. You know, they wouldn't want to do a visit every week, for example. They would make a professional judgment about what's appropriate. So I didn't know what else there might be, Malcolm, that led to your inquiry, really.
Malcolm.
Thank you. Yeah, when I first got elected, there was a staff governor. I think he works at Rampton, and I've got to apologise, I forgot his name. He was having difficulty because his line manager was making it difficult for him to do the role. I've heard someone else say the same thing, that it's been difficult for them, and so I asked the question because I've got a line manager who supports me 100%, and so I get allowed time to do things. That said, I was on nights last night and I'm still here, but that's fine because I committed to do the role. But so my question was based on staff governors being. I'm trying to be nice about this. Are they being resisted by line managers from taking the time to do the role? And I get with COVID, it's been really difficult, staffing levels. I mean, my own team is really struggling for staff. So, I understand that a little bit, but I just wondered, that's why I posed the question.
Yeah. Well, and I would like, sorry, Jim, if I may continue.
No,
I have checked with both Lucy, and I understand there's nothing specifically in our constitution, but there is this reference that's picked up in the point there that's logged. But Claire has reiterated with me, as today, this morning, when I raised it again, she said, please, if you are aware, or if any staff governor doesn't feel as though they're getting the right level of support, or it's a different type of support, not just time, please would you get in touch with her, and she would be happy to see what she could do to facilitate things. So I don't think Claire's been able to make the meeting today, but so I wanted to make sure that it's not lost and it hasn't been ignored, but that's the situation as it was. And Jim, if I may just pick up the second one, which was the point that I think it was Helen that raised. You've got a very detailed explanation, and you've heard from John today about the issues around the COVID and the numbers and so on. Could I just assure governors that at our committee this morning, which was as I said, the PCE and I committee, the People, Culture, Equalities and Inclusion Committee, we were very keen to understand the numbers, and John has given you the indication of roughly sort of 89% of staff have been vaccinated, and in fact my understanding it's something like 81% have had the double vaccinations and so on. So all the information that you've had from John was reiterated today at our meeting when we were putting in appropriate challenges to see how staff could be supported, whether it was the workshops, the one-to-ones, the wraparound service. We haven't been ignoring any of those either as a committee. So it is one of the key things at the moment. The major issues for us are the vacancy issues around the organisation and ensuring we make sure everybody is vaccinated. So I just wanted to give you that further assurance that we were trying to be on as far as we could on top of it, but as supportive as possible for all staff. Thank you.
Thank you, Sue. I noticed, Becky, do you want to come in on this issue, or is it something separate?
I was only going to comment on the bit about supporting staff governors into doing the role, but I don't want to labour the point. I think it's been covered. But the only bit I was just going to add is that I know in the past, between Lucy and I, we've had some really useful conversations with line managers about what governors are there to do, because I think sometimes that's a bit of an issue, is they don't quite understand what time out for the governors means to do their role. So sometimes it's just a bit of an intervention at our end as well. So I was just going to add that point, that's all.
Okay, thanks, Becky. Can I come now to I've got Graham, then Caroline, then Helen. So Graham.
Hi, yes, thank you. Yes, going back to support for governors, I did actually need, when I first got elected, to seek Claire's support through Lucy. I was asked by my modern matron to put forward a courses and conference request as a governor. So yeah, it has been in the past a major issue, and we have through that lost one of our governors from Rampton who was exceptionally good, but he just felt so unsupported that he could no longer continue. I must admit, as things have moved on now, I certainly do feel quite well supported by my management team that I have currently.
Okay, well, thank you, Graham. That's good to hear. Thank you. Carolyn.
Hi, Stephen. Thank you. Carolyn White, Non-Exec Director. My apologies that there isn't an update on Helen's inquiry about mental health support into schools. Now, I did make an inquiry about this, but it was November, so it's 3 months and a lot of gin and tonic since then. So I think I'm right in saying that the support to children in schools is primarily through the school nursing services. Clearly, if children are referred into mental health services, it would be through the CAMS service, but we don't have mental health practitioners per se going into schools, although there are some schools, particularly senior schools, that have psychologists that work as part of the school team.
Okay. Thanks, Carolyn. John, do you want to come in on that?
Yeah, just to say, to enlarge on that, we do have what are called mental health support teams, which don't give very much indication that they are actually targeted at children and young people. So the MHSTs, and they're an interface between the child, the family, the school, and our services. Which started probably a couple of years ago. Our county is at the forefront nationally in the rollout of these. There's an ambition that all senior schools will have coverage from an MHST. They've been particularly rolled out across the county. I can't remember off the top of my head how many there are, and there are one or two just starting in the city. They've been extremely well received. They're a sort of joint endeavour with local authority, and they've got educational psychologists, social workers, and mental health practitioners that identify predominantly anxiety-related problems, but a broad range. But they also help support the school to develop the skills to manage things themselves. So there's a big training component. And we hosted a ministerial visit last year to one of the large schools up near Ollerton, I think, that was really well received. And there's some tremendous work going on there, and I think it's a really good example of getting in early, early prevention, early intervention, prevention of long-term problems. So just to sort of give a little bit more, sorry, it's a verbal update on the work we're doing there.
Thanks, John. So come back to you, Helen, now.
Well, it's encouraging to hear what John's just said, and I'd like to think it was rolled from the county to the city inclusively. I taught for nearly 30 years within inner city schools, and I saw children who were self-harming, who were depressed. There were pregnancy issues, depression, all sorts of issues, which with this pandemic possibly can create a tsunami of problems in the future. So if there's this infrastructure in place, it will certainly support earlier than you'd possibly anticipate the problem being recognised. That's really positive. If that makes sense.
Thank you, Helen. That's good to hear that. Jim, any more about the issues log?
I added two myself that were in relation, as you can see, to legal issues which were responded to. One was a kind of holding response because the inquest at the time was ongoing, and the other was about an historic incident now, 6 years ago, which led to a comment about a review. I read those responses as work in progress, Chair, and I'll take them up a little further for the next meeting and see if there's any update. Thank you.
Okay, so we can roll them.
We can move. Yeah, we can move forward.
Good. Are there any further questions? I know both John and Helen have. Oh, John, your hand's gone down. Helen, your hand is still raised. Do you want to make another point?
I apologise for my lack of tech skills.
There's always one, isn't there? It's normally
There
me.
is. It's usually me.
Okay, thank you. Good. Well, no more questions. I think I can move on to the next report. I can do this with some confidence because I wrote it. So I think if I could just start by saying this report is about providing assurance to the Council of Governors about the ways in which the non-executive directors seek their assurance in board committees and in other places, and what essentially is included in this report are a series of examples. It's by no means completely comprehensive, but it does include some of the main points. The one at Lings Bar is something that's carried over from last period and was mentioned in the previous report. But again, the Quality Committee continues to monitor progress in that area and is feeding back to the Board of Directors on a regular basis. We've heard an awful lot about the pandemic, and John has covered that, and the questions have covered that in great detail. But as we've been going along, the non-exec directors have sought to gain their assurance, around essentially the service provision, quality, and staffing levels against the Omicron wave. We have received updates from John, from Anne-Maria, and from the Director of Community Health Services, and that's focused again on staff attendance, infection control, the compulsory staff vaccinations and derogations. And whilst as you've heard, the situation remains very challenging, we have received our assurance that we are dealing with difficult issues on a regular basis. We've also, as a group of directors, and so probably both non-exec and executive directors, about looking at the way in which we deal with our governance in these difficult circumstances, and we're continuing to be mindful of the pressures that individuals are under, and we're trying to manage all of that in a sympathetic manner. The CQC issue remains very live for us, and undoubtedly one day we will get our inspection, but I think we are in good shape. We can assure the council that staff at all levels are receiving training and support, and the NEDs themselves we've gone through some pretty rigorous preparation sessions. So when the inspection comes, hopefully we're ready. And then the last item is around the ICS, and I don't know whether people might have picked this up in the press. I don't think with what's been happening around Westminster, perhaps this has not been picked up as widely as it might have been. But with the issues around COVID, the legislation on ICSs has been put back now to a new target date of the 1st of July, whereas it previously been the 1st of April, and this is giving more time for Parliament to deal with the health and care bill and to provide extra flexibility. From a NED's perspective, that's giving us more opportunity and more time to to make our interventions and to get involved as widely as we can. I think that's pretty much it as far as the report's concerned. For those of you that were involved, had logged on a little bit earlier, you'll be aware that there have been two meetings that have been held since this report was produced, and I'm just going to, before opening up for questions, just invite the two chairs of those committees to give an update. And I start with strategy. Steve, you had a meeting of strategy earlier this week. Is there anything that you think needs to be reported?
Thank you, Stephen. Appreciated. Hi, everybody. Steve Banks, if we haven't met before. The strategy committee is in good shape, Stephen, is what I'd feed back, and its purpose really is to make sure that the trust has appropriate plans and strategies in place to make sure that we take full benefit of the system working and that it benefits patients and carers. Where I think it's evolved to is to really be spending time helping to shape the thinking to feed back into the wider board. And the sorts of areas we're covering, including at this last meeting, is the absolutely the change in expectations in terms of the go live date for the system, and particularly covering the implications of provider collaboratives, where we work in cooperation. The largest one, which they call provider collaboratives at scale. So we're a provider as this trust. And we are forming an agreement and arrangement with Nottingham University Hospitals and Sherwood, as you will have heard before, as a group of governors if you were at that presentation. So we've been looking at the governance arrangements, testing out where decisions will be made, making sure that that doesn't conflict with our own responsibilities as a trust. And the second major conversation was about place-based partnerships. So this is the way that the health and social system, I was going to say will be administrated, but that's not quite right. Will be run at a more local level and have more local input and decisions. And we discussed about the progress there, the priorities of those groups, and again, how we feed into that as a trust to make it successful without jeopardising our own responsibilities. So I'd say they were probably the main two conversations, Stephen.
Okay, thanks, Steve. And Sue, you've come hot foot from a meeting this morning.
Yes, absolutely. We had quite a length. Sorry, Sue Nixon, non-exec director, and I chaired the People, Culture, Equalities and Inclusion Committee. We had quite a lengthy meeting because there were lots and lots of various things on the agenda. But as you will have picked up today, the main game in town, unfortunately, is having to deal with all the stresses of not just COVID, but vacancies, staff going off poorly, the stress and the strains of all of this. And it's causing, a lot of difficulties. And I think staff have been absolutely working their socks off, and special thanks really to all our staff, because working over this Christmas period, as you've heard, has been very, very difficult. And I would wish to have on record my thanks to all members of staff that have worked so hard, not just during the Christmas period, but throughout the whole pandemic period. And it's been very, very difficult. And I think it's been clear to the committee that apart from that, as you've heard earlier in the agenda, ensuring that we've got as many of our staff vaccinated as possible because of the legislation coming in, those two things are prime areas of focus at the moment. However, you know, some of these issues could well be cropping up in the future in terms of vacancy. We're mindful that maybe in time we're going to have to look at our establishments again, the way our teams are made up, the different skill mix. So those sorts of things are going to need to be on our future agenda. We're coming to the end of our workforce strategy timescale, and as you know, the Trust is developing a new trust strategy, and some of you will have been involved in some of the consultations. So the workforce strategy will be an element falling out from that. So we need to be thinking clearly how we want to transform things for the future, so that we provide an organisation where staff really think it's a great place to be and everybody wants to come to us. However, because of our staff vacancies, we've also now put in train the consideration of a business proposal to advertise internationally. So that was something that cropped up today to see if we can explore how we can boost our numbers. Other things that have come to light today, well, we've mentioned in passing before, but we're thoroughly excited the fact that our occupational health service has now come in-house as of the 1st of January. So that will see an awful lot of support in terms of staff health and well-being. So that's really good. And I have to say, one of the other things we know we're expecting the results on are the National Staff Survey. We had a slight increase, I think, in just a minor increase in the numbers of people participating in the responses. But all of those results have yet to be analysed and explored. And obviously that will give us an indication around a range of issues and help us to focus on our priorities over the next year or so as well. So those are the types of things that have cropped up, and we were also exploring issues around a deep dive as well, but I think more of that will come to light in the future. And finally, you will have picked up that, as you know, Claire Teeney does give us our lead in terms of people and culture, not only in this organisation but across at Sherwood, and she's been very influential with other members of staff across our system, as we know, in terms of ICS work. And so there's been an awful lot of collective thinking about how things need to work on, around the people agenda across the system, and we've been influential in shaping the strategy that's come. It was developed here and I gather is about to be adopted, if it hasn't been adopted already, across the system. So loads and loads of things going on, loads of different types of performance reports, but the challenge is, the real challenge is the difficulty in terms of our gaps in workforce and vacancies and so on. So that will be a big escalation really in terms of risk. Thanks,
Sue, and sorry for dropping that on you with no notice whatsoever.
That is absolutely true, but there we go, never mind. That's what happened this morning, folks. Okay. Thank you very much.
So could take any questions first of all on the report, or indeed on any of the comments that have been made by Sue and Steve. Let's start with Helen.
Regarding staffing, which is an issue, and I'm not on commission for the Times newspaper, but it happens to be in the paper today, that the pandemic inspires new generation of trained nurses, and there's a huge interest since the pandemic, ironically, in a career in nursing. And when we had a meeting the other day with Jim and Malcolm and Tess, we discussed how to make mental health nursing appealing to youngsters to join the team in that specific area. And I think that's something that is quite important, really. It needs some thinking and some media input to galvanise young people into joining. The irony of it is a lot of the young people I know do not agree with the vaccination. But that's another issue for the future.
Indeed. And I think you've got a good response there, looking in the chat bar, Helen, from Anne Maria, which is saying that we've had quite a lot of interest across the trust.
Can I add to that, Stephen? I think we were told at a previous committee that some of our staff are also going into schools to encourage greater interest and understanding about careers in nursing when it comes to career fairs and so on like that. So it would be nice to build on your comment, Helen.
That's good.
Okay, thank you. Jim.
Yes, thank you, Stephen. Just a quick point, really, and thank you, by the way, for such a concise and focused report. At the bottom of page 34, you make reference to assurance visits resuming when they can. We fully understand the reasons why we've not had assurance visits, but just to let you know that I would say the single biggest welcome from any governor on the council would be the resumption of the opportunity to go with our distinguished non-executive directors on assurance visits, as and when we can. Okay, well, speaking as a non-executive director, I mean, I think I speak on behalf of all my colleagues that we unanimously think it's the best part of the job. Second, of course, to appearing at Council of Governors. Of course. We obviously want to recommence as soon as we can, but it's just being mindful of all those issues that we've heard this morning. And I know that John and the executive team are very well aware of this issue, and I'm sure we'll be able to recommence at the earliest point that is possible and sensible, given all the other stresses and strains that we talked about. Pala.
Thanks, Stephen. Thanks to and thanks, Steve, for highlighting the salient points quite succinctly in your reports. Just a quick point on the ICS. Yes. And it's a good thing that we've got some more time, few more months before it is sort of like becomes a real thing. To paraphrase John, when we have met in the last face-to-face governors council, if someone says that we understand ICS, that means they don't understand ICS. It's almost like quantum physics. But I think it'll be useful to get some updates as it progresses in the coming months, if that can be brought back to the council to keep our sort of understanding of as it takes shape. And I think, if I may dare to say, things are probably, the structure of it is looking slightly more clearer than it was last year. And some of the factions and some of the elements and threads of it has already started functioning different levels. But it'll be good to for I know, Steve, you are leaving our organization, but it will not be far. But whoever takes your role, probably, if the further progress and updates can be brought back to the council, that'd be helpful for all of us.
I think John wants to add something on that, but I think I can certainly commit that the council will receive regular updates, because it's just an issue that's ever present in all of our lives at the moment. John, do you want to come in on that issue?
Yeah, just if briefly, if I may, on both those points, really. Everyone will know that I'm the biggest fan of working in mental health and learning disability services, and do not be unsure that we're not trying our hardest to encourage all and sundry to come and work in our wonderful organisation, but we are batting against some very tricky national terrain, both in the perception of the NHS, working in the NHS, some of the terms and conditions, deteriorations comparatively, some of the previous lack of access into training through the universities, which Anne-Marie has alluded to. We've had significant increase in numbers entering courses this current year and next year against some really fallow years. So there will be a bit of a gap until those people are trained up, but we're optimistic for the future. We just got to get there. But it's a really, really tough environment to recruit from. But we are on it, and we continue to do some really innovative work with our clinical teams, with HR and with comms to get the message out there. And the second bit on the ICS Palab, it's always the case with these very significant 3-letter acronym transformations. It takes people a long time to get their head around. And the key thing about the ICS for the council is that it's becoming a thing. So it's not becoming a thing in April, it's becoming a thing in July, where it will be formally constituted, it'll have legal statute, it'll have paid employees, and it will have operating procedures, terms of reference, etc. At the moment, we're in a sort of a murky shadow land, which makes things a little bit unclear. That the reason it's important, and I think will become clear in the coming months, is that what it contains. If it contains organisations that can work together collectively within a provider collaborative or an alliance, and they can essentially be the large percentage of what the ICS is. So the opportunity for our organisation to both commission, to provide, to improve quality and outcomes for people is immense, and that's the thing for us to be able to go at. So it's, despite the chaos of the pandemic and the challenges of recruitment, there are, I think, real opportunities to do things better for people, and to support our staff to do great things. So I just encourage people to keep involved, to watch out for that, because there will be various briefings and workshops and webinars, so that because there's an awful lot to come out, and it's ever evolving. We sort of having weekly updates of, okay, these are the new rules of the game. Thanks, Stephen.
Thanks, John. That's really helpful. Helen, again, you've got your hand raised. Have you got another question?
No, thank you.
All right, thank you. Good. Well, I can't see any further questions there, and so but I think we've given those issues a good airing, and I hope that's helpful to the council. So I think next on the agenda is the chair's appraisal report, Jim, and it's I think you've got full rein. Paul's not here, so you can say what you like.
Steve is here though, and Steve was a hugely important part of the process. Just to say, colleague governors, this is part of our work every year in assurance, and it's my second year of being involved in it, again with the pleasure of working with Steve. If you've read the report, you will see that a couple of things really I'd like to highlight. I'd like to begin by saying what a robust process it was, and it met all the requirements of the national standards, which are commented on in the report. We had 27 individual pieces of appraisal evidence. You'll see that there was an assessment against 5 competencies, and there were an internal and external consultees. So I think governors can be satisfied it was a compliant process with the national standards, and it was robustly conducted. And the outcome, as you can see, is an overwhelmingly positive one from the point of view of the chair of the trust, Paul, who can't be with us today. Steve and I had a procedure for engaging with Paul, and of course he did contribute to the process with a self-assessment, which the report comments was harder on himself than some of the other respondents had been. In summary, I would say, because it is a detailed report, progress was made against the expectations, the objectives set for 2021. That's identified on page 38 of this document, with summary comments against it. And from the point of view of the Council of Governors in January 22, I think I would draw your attention to what is perhaps the most helpful part of this, which is the objectives that, following a discussion with Paul, have been set for the current year on page 39 of the document. Concise, focused objectives, bearing in mind another item on the agenda today, new directors coming on board. So to build the new board of directors future facing with what we've just been hearing about the ICS, but also remembering the vital importance, as John has been outlining, of the services we provide ourselves as a trust. To continue to champion equality, diversity and inclusion within the trust and also beyond the trust within the new system. And something we spent some time on, colleague governors, I'd like to draw your attention to Objective 3, to enable us to connect and engage as a Council of Governors with the services, and with a review that is pending on the constituencies to make sure that the way in which we comprise ourselves as a council is most effective and efficient in representation terms. And the fourth objective for the year is the system engagement one. So overall, a very effective process, a very effective contribution by the chair, and I commend the report to the council. Thank you, Stephen.
Any comments or questions for Jim? Good. I'm not seeing anything, Jim. So I think it was a very complete paper, and it was as you say, a very strong and robust process, and many of us had an opportunity to make our contribution into it. So so it's good we've got such a good outcome. So staying with you, Jim, for the next paper, the new non-executive directors.
Yes, this was the single meatiest piece of work that several of us as governors undertook with the trust board representatives and corporate services in December. It's a decision item, colleagues. I draw your attention to the fact this is a decision item. We need to make a decision today on it, and that is the endorsement of the recommended appointments of non-executive directors that were made following a robust interview process in December. Again, I'll take it that the report's been read. The recruitment process was supported by Hunter Healthcare. I'd like to say through the chair that I was impressed by the way in which they were able to attract a broad field of candidates, recommend a long list, and to say that I participated in the long listing exercise as well, and we made, as a small panel, 1 or 2 changes to the recommended ones to ensure breadth, diversity and representation within the final shortlist going forward. Just checking the page numbers, page 41 in the executive summary outlines the panelists who were involved in this, and again on the record my thanks to all of our colleague governors who supported that process through an arduous 3 days of formal interviewing. And you can see that in terms of the key requirements from the needs of the trust, we needed to be able to recommend a candidate who could chair the audit committee, pending the vacancy created in the summer this year. And we were looking for 3 other non-executive director members. At the bottom of page 41, we identify particular aspects or skill sets, or let's say experience sets, that we would have particularly welcomed. I would like to say through the chair that we feel that we appointed people with skills or high-level skills or experience in all of those, with the exception of digital, which will be on the list for next time. It wasn't that we didn't have the candidates, it was that in terms of overall contribution to the board of the trust, we felt that the ones we're finally recommending to you were better strategic appointments. And the report goes on to describe the process. I won't go into the details of all of that, but then on page 43, the candidates are identified by background, not by name, which is the convention here. The names, of course, will be shared once the endorsement is given. We summarise the way in which we would make changes to the process where we would do it again, just to sharpen it somewhat in the learning section of this report. And then we go on to ask the Council of Governors to approve the recommendations. Thank you.
Good. Thank you, Jim. It sounds like it was a good process and that you got a variety of good candidates.
And I would welcome comment from other governors here today who participated in it.
Yeah. So any comments or questions, contributions from other governors? Seems not. Malcolm.
Thank you. Yeah. Just to back up what Jim said, really, it was quite a long and arduous and difficult task. There were a couple of candidates that I felt should never have applied. Just they seemed to sit there almost yawning, and and I would have been embarrassed to sit in an interview and answer things like they did. But all in all, quite a good process, quite a good depth of questions that were asked. And we all more or less took a question or two, and I think it was a long process, but it went really well. And I think we've got some good candidates, and I would recommend the ones that we chose. Thank you.
Thank you. Thanks, Malcolm. That's helpful. So there's no further comments or questions. This is for approval. Can I ask for agreement that we go forward with these appointments?
Do you want that through the meeting chat, Stephen? Or
well, either some indication, yes, through the meeting chat would be helpful if you could do that, and then we've got a formal record. And I'm starting to get some yeses now. Yeah, I think we're there on approval, Jim. I think we can take that as accepted. Thank you.
And once again, thanks everyone who participated in it. In my experience, a record number of governors on the panel. And now the decision's been made, I'd like to say to non-execs attending today that one factor that we bore in mind was the fit with you, the contributions to the board overall. And I honestly feel that they'll be an excellent fit. Thank you.
Thanks, Jim. Good. If we can now move on to the next paper, which was to be presented by Paul, which I'll pick up. Shirley, before I start, have you got comments?
I have, yeah. We should have declared an interest before this paper. Sorry, Carolyn, did you want to say?
No, I was going to say, do we need to leave?
Yeah, so that was going to be my question. So we should have declared an interest at the beginning of the meeting. So obviously Carolyn has an interest, so it's just whether COG require Carolyn to leave for this paper.
And Trevor, I think Trevor's on the call somewhere.
Is Trevor on the call? Oh yeah, and Trevor.
Yeah,
Trevor's
yes.
on the call.
Yeah. Yeah, so colleagues, I think traditionally when these things have been done in the past, we've asked people to leave the room, but I think, perhaps to follow the protocol, if both Carolyn and Trevor could log out for a few moments, that would be helpful.
Can we be moved into a waiting room, Shirley?
If you can, I don't know how to do that, Carolyn, but we'll...
Just a suggestion, if it helps, if they log out, and I'll WhatsApp both of you as soon as we're at the end of the item. Will that be okay?
Yeah, that's fine. Thanks, Steve.
Thanks. Thank you.
Keep it simple.
Bye-bye.
Thank you. Thank you. So I think the paper is straightforward, and it identifies that both Carolyn and Trevor are coming to the end of their first term as non-executive directors, and the proposal here is to reappoint both of them for a further 3 years. In Caroline's case, that would start on the 3rd of March, and on Trevor's the 23rd of January. I mean, speaking as colleagues, both of them are tremendous colleagues. They bring very different experiences to the table, but both are highly valued, by us as non-executives, and I think they've done a fabulous job since they've been appointed. But happy to take any questions, Jim.
Yes, thank you, Chair. Just to point to the section of the report that mentions the Nomination and Remuneration Committee meeting, which scrutinised this proposal and was supportive of it on the basis of the skill sets involved and the contribution to be made at this time in the life of the trust.
Thank you, Jim. That's a helpful addition. So, any questions or comments? Benga.
Yes, I don't have a comment. Sorry, I just wanted to let the House know that I have been unable to participate in the chat. I don't know why that's happening. I can't do any of the charts. I was trying to do my responses and contribute and ask some questions, but I couldn't find the chat key on my on any of the what's it called now, on the MS Teams app. I don't know whether I was disabled, or maybe there's a problem with my connection.
Well, I think for future meetings, Benga, we need to get that one checked over, and I think we can get IT to look at it. I think the only thing I can say is that from the vast experience that I have of MS Teams is that occasionally that happens.
Okay.
And right. I don't think it's anything particular or personal. I think it's
no. I know. I mean, it's
more random.
So, yeah, exactly. I just wanted to let everyone know that I wanted to, on the voting and also on the other things, I wanted to, put in some comments, but I couldn't do that.
Okay, well, thank you, Benga. I mean, if there's anything that you'd like to, pick up after the meeting, more than happy to.
Absolutely, do that. I will do that with Lucy. Oh, well, thank you.
Okay, thank you.
Yes,
Malcolm.
Thank you. Yeah, just to comment really. When we chose the new NEDs, we chose them with the current structure in mind, which included Carolyn and Trevor, and I think they've done really well, so I can't see a problem.
Okay, thank you. So again, this is requiring a decision, and can you put that in the chat, please, if you're in agreement? Oh yes, we've got plenty. So thank you for your support on that. And Steve, I think if you could let Caroline and Trevor know that they can log back in.
That's done. Thank you, Stephen.
Good. And so that then brings us to the penultimate item, I think, on our agenda today, and we've got John Williams who's joined us for this item, and this is about the external auditor's contract. So, John, would you like to present this item?
Yeah, certainly. Thanks, Stephen. Hi all. For those who don't know, I'm John Williams. I'm head of procurement. I was involved in the procurement of the external auditors 3 years ago. Hopefully, very much like the last item, it's a very straightforward paper. Basically, we've had our external auditors for the last 3 years. It'll be 3 years in June. They're doing a very good job. They were competitive when we tendered, and the proposal is to extend their contract by 2 years to the full 5-year term, which will bring it up to May 2024. And the other thing to sort of bear in mind, as well as I'm doing a good job and being competitive, we do often struggle to attract external auditors for all NHS trusts do, because if you're an external auditor, it means you can't do other potentially more lucrative work for the trust. So I think given the market, given they're doing a good job, and given commercially the sound, the proposal is that we extend the contract for 2 years. So very happy to take any questions.
Okay. Before opening that up to questions, I'd just like to add. I mean, this covers very much my world, and I can say I think Mazars have done a really good job since we appointed them as our auditor, and it's been in very difficult circumstances. You know, they've managed that professionally, but also, you know, it's the relationships they've built with the finance team and others, I think, has been exceptional in their work. I think the other thing I'd observed that from what John has said is that the whole world of auditing is not a popular one. When you think about it, and you probably will have seen things in the press, it's an area of high risk if you get the audit wrong, and yet over time the NHS and many others have worked very hard to sort of keep the audit fees down. So it's a low level of remuneration for a high level of risk. So it's not the most attractive thing. And there are actually 3 NHS foundation trusts out there who currently are actually struggling to appoint auditors. So I think the fact that we've we've got the relationship with Mazars is very helpful. So happy to take any comments or questions on that. I'm not seeing anything, so can we put that again through the chat bar for your approval, please? And again, I'm getting a series of yeses. So thank you, John. That was helpful and very clear. So I think the final regular item on the agenda now falls to Lucy, and that's an update on the elections.
Yes, thank you, Stephen. Just a very quick update to let you know that we're now in the ballot stage of the governor elections. You can see in the table in the paper that 2 of the constituencies were uncontested, but we're waiting for the other constituencies that need the vote. And voting closes at 5 p.m. on the 11th of Feb, so we will get the results in the following week, and then we'll be looking to start an induction programme for those new governors who will be commencing their term of office on the 1st of March of this year. And just wanted to say thank you to the governors who you mentioned previously in the meeting who are outgoing, and thank them for their time with us. Some of them are up for re-election, so good luck to those, and we look forward to welcoming some new governors as well.
Thanks, Lucy. That's very helpful. Carolyn.
Yeah, I was just disappointed to see that we didn't have an allied health professional nomination at all, and I just wondered if there was anything that we could do about that, Anne-Maria, to encourage people to come forward.
We went out far and wide. We went out to all the HPs. I got Della and Suzanne on it. We pushed. We got the current governors to try it, nothing.
Oh, okay.
It was surprising because in the previous election we had about 5 AHP nominations. I don't know whether those people who put themselves forward and then didn't get elected in were reluctant to try again, but we did have quite a few last time, so it was a surprise.
It is disappointing because there are a group of staff that quite often say they're underrepresented, aren't they? And however, I thank you for your response.
Okay, thanks, Carolyn. Rhiann.
Yes, hi. So I am the other AHP governor. So just to confirm that we have been promoting it in our trust AHP meetings, and I haven't had any kind of people contacting me at all for a chat even about it. So we have tried, but we'll keep trying. But yes, it is disappointing.
Well, so noted. I think the message there is to keep trying.
Yeah.
Jim.
Yeah, thank you. I think there's some weariness out there, Rhiannon, isn't there? And there's maybe weariness among our members for those who didn't contest constituencies like the one I'm in. But my question really, Lucy, is given that our next meeting is in April and people will have joined, and you mentioned induction, could there be a way in which our current experienced governors have the opportunity to contribute to the induction of new ones?
Yes, yeah, don't see the problem with that. We can.
Perhaps that's something we can talk about at one of our meetings in between.
Yes, yeah, definitely. Okay. Thanks.
Thanks, Jim, and thanks, Lucy. Palab.
Yeah, just about the AHP interest in running for election for governor's role. I remember we did some chatbots last year. I wonder whether something like that with people like Rhiannon, a little chatbot, sharing their experience and the positives, and then circulating through our comms might be useful. I wonder.
Thanks. That's a helpful interjection there. Thank you. Can I? I think we've got no further questions there. So I just wanted to let Caroline and Trevor know that you've both been renewed for your 3 years. So your service and sentence continues. So hard labour for the next 3 years. Well done to both.
Thank you.
Good. That then brings us to items of any other business. I've not been informed of anything. Is there anything anyone wants to bring forth?
There is one from Yolanda. It's the communications and engagement briefing update.
Yes. Yolanda, are you there?
I am. You should be able to see me. I can see me. Hello, everybody. I'm Yolanda Martin. I'm the Associate Director of Communications and Engagement, and I've been making some notes of the comments that you've been making about the other items that have a communications or an engagement piece. So yes, plenty of actions there. If you go to the third page, I think it's page 54, this is something similar to a briefing that I give to the executive team and the senior leadership team each month. And the executive team felt that it might be helpful and useful for Council of Governors to see something similar. So basically, it just depicts in a really simple way. The whole point is that it's not intended to be complicated. It's just meant to be something simple that gives you on one page a flavour of what's happening across the organisation. So basically, we've got the hubs so there's internal and system, there's campaigns, there's media, and there's the staff recognition bubbles. And the outlines around the bubbles, if they're green, it means that we think that's likely to have a positive impact on the reputation of the organisation. If they're red, we're saying it's a negative, and if they're amber, we're saying that's a neutral impact. So just to sort of talk you through a few highlights. So I would draw your attention to the sort of top right corner. The staff pulse survey is the quarterly survey that goes out. It's the national survey, but it's not the annual one. It's the pulse survey. We've had 159 responses. We've not been pushing this massively because we feel that many of the staff are a bit survey fatigued, but it's something that we do nationally. So we've just been trying to encourage colleagues to comment. In the bottom sort of right hand corner, there's all the campaigns that are coming up over the next sort of couple of months. The ones that relate to us. So we have a forward planner for the next year, and we have all of the campaigns right across the whole country, well, in fact, the world actually, for things that are relevant to us. And these are the ones that we feel are relevant to our organisation, that we will be participating in as an organisation to a greater or lesser extent. So, for instance, there's Brew Monday, which was historically referred to as the sort of saddest day of the year for many people. It's LGB History Month throughout February. We're already in dry January. Mental Health Nurses Day is coming up towards the end of February. The media section, the sort of lilac-y, pinky colour. This month, so we report on the month before and give a forward look for the things that are coming up on the horizon. So in terms of media coverage for the organisation, it's been sort of neutral this last month. And most of our negative media coverage comes from inquests that we're involved in or our patients are involved in. And the positive stuff, I'm really pleased to say that the positive stuff tends to come from the proactive media releases that the comms team have gone out there for. And the media inquiries are reactive, and we've received about 6. There's just a little bit of feedback about the social media there, and we continue to grow our social media engagement with people. On the next page, on page 55, there's a glossary of terms for the social media. I know that some of you are very active on social media, but some of you aren't. So there's a glossary of terms there just to explain what we're talking about. Really happy to receive any questions or any feedback, and particularly whether Council of Governors feel that something like this each time the council meets would be helpful, then I'd be happy to provide this each time.
Thank you. I think we're getting a lot of thumbs up, which indicate that people have liked what you've put forward, Yolanda. So I think you've just earned yourself a job for the future.
Okay, happy to have that task.
Thank you. So I think that brings us to the close of the meeting. I think we have our next meeting scheduled for 4 p.m. on the 12th of April. I think in summing up, I can think that we've had a good meeting today, and I hope you've enjoyed it. Paul Devlin is secure in his role as chair after my abject effort of being 7 minutes over time, so I'm sure I'm going to get a lot of ribbing for that, because I'm normally quite good at finishing on time. So anyway, I wish you all a good afternoon, and thank you for your contributions today.
Thank you.
Thank you.
Thank you.
Thank you.
Thanks, Stephen.
Thank you.
Thanks, Stephen. Well done.
Bye, everyone.
Thank you, Stephen. Well done.